catheter irrigation. The catheter is introduced as described in Chapter 4. If the anterior urethra is to be irrigated, the catheter should be not larger than 15 French and should be introduced about 12 centimeters into the bulbous urethra. If the posterior urethra is to be irrigated, the catheter, 16 to 18 French, should be introduced until its eye enters the bladder and a few drops of water flow away. As soon as the bladder has thus been drained, the catheter is withdrawn 1 to 2 centimeters into the posterior urethra. The fluid is then introduced by tank or syringe. If the patient can empty his bladder, the catheter is then withdrawn and the fluid urinated out. If there is retention, the fluid must be withdrawn by pushing the catheter back into the bladder. If the retention is slight, either method may be followed. Instillation. The keys or the Guillain instillator may be employed for fluids. Only the former can be used with ointments. The object of instillation is to place upon a given portion of the urethra a few drops of a solution so concentrated that it could not be used over an extended area or in large quantity. The instillator is introduced like a sound or a woven catheter. Inasmuch as the instillation is usually intended for the prostatic or the membranous urethra, one should have a clear idea of the precise position of the instrument as its tip enters the posterior urethra. The jump as it passes the external sphincter is often quite palpable, but in case of doubt, one may always feel confident that when the instrument has reached a point in the urethra where its shaft rests without pressure at any angle between the perpendicular and the patient's feet, its point is in the membranous urethra, figures 42 and 43. Beyond this, the instrument should not be introduced. The fluid injected will bathe the whole deep urethra. In order to instill an ointment, I employ a screw piston syringe screwed to the keys instillator. The syringe must be taken apart for filling. I see no peculiar virtue in any of the numerous ointment applicators that are devised from time to time. Figure 42, tip of instillator in bulbous urethra. Figure 43, tip of instillator in posterior urethra.